Hello and welcome from Baltimore City. As you can see here, we are joined by pretty powerful Latinas headlining the health and healthcare of the immigrant community. We welcome you to the 2022 Social Justice Summit, Immigrant Voices, presented by No Studio and CASA. CASA is an immigrant advocacy powerhouse, and I'm proud to say that I'm joined here by Dr. Michelle LaRue, Director of Health and Human Services for this organization, and we're going to step into understanding the health of the immigrant community and ultimately the factors that erode what could be a very powerful community if we overcome the structural barriers that keep us from being so strong. Dr. LaRue, before we get into it, why don't we talk a bit about the pandemic, this major global moment that has changed the lives of so many people. And if we can reflect on January of 2022, back when we just started hearing about this coronavirus, eventually everything shut down. And what that meant was people's work styles changed, children and other people going to school, their education changed, and we had to navigate what our world would look like, all while maintaining our health, mental health included, thinking how we were going to educate our children. If we were lucky enough to stay home and work from home, that's great. But how are we going to do that if we have to go into a workplace and still stay safe from coronavirus? There was a moment when we didn't have vaccines, so we could not be sitting as close as we are sitting today. And I can say that as someone who volunteered to be a part of the Moderna vaccine medical trial, it was a scary moment to understand we're on the precipice, on the very forefront of health innovation, because we are making it up as we go. But before we go too far down into the pandemic and the response that we put together and what that looked like and what are the outcomes, why don't we get a lay of the land? Dr. LaRue, can you talk to us a little bit about what is public health? What are the factors that play into the health of a community, and what things don't we think about that play into the well-being of populations like the immigrant community?
Yes, thank you, Josie. That's a great question. When we talk about public health, we talk about 5 major categories of things that affect our health. Usually we think of just medical care as what normally affects our health, but that's only one small piece of the puzzle. Yes, access to care and our health is a major critical factor, and our communities are very much affected by having lack of access to care, whether that's affordability or living in a healthcare desert, or even physical barriers like having transportation barriers to getting to healthcare. But we know that other factors also play a critical piece in building our health as an individual and as a community. So like our neighborhood and built environment, talking about like the quality of our housing. Do we have lead-based paint in our homes? The crime and violence in our neighborhoods. Can I get to the park and exercise, or is it unsafe to walk the streets of my neighborhood? Our environmental conditions of our neighborhoods. What is the air quality? Many times communities of color live in poor quality neighborhoods. We know that education is also critical for a critical factor for health. High school graduation rates, language and literacy rates, all of these things have direct correlations with our health, and then with other factors like economic stability. Education leads directly into economic stability, like fighting poverty and employment prospects, dealing with food insecurities and housing insecurities, which many of our community members face and faced even before the pandemic. The pandemic only exacerbated these issues. But there's one other piece that I think oftentimes is overlooked, which is like the social and community context factors. And so social cohesion, civic participation, bringing down barriers like discrimination and inequities, which is a big part of what we do at CASA. Like you were mentioning, we're an advocacy organization advocating for our communities, and this is a big part, and really we could see all of the CASA work, no matter which department we're talking about, which portfolio of programs, really as a public health organization. All of these together help build a healthy community and healthy people.
Thank you, Dr. Lario. I feel like that gives us a better understanding of the world before the pandemic, right? And what we're going to do is delve into the reality that we live in today, and really look at the different factors that affect our health. You outlined the color of our skin, our immigration status, the house we live in, how polluted or the climate around us, as well as how much money we make, our education. I mean, these are different pieces that all add into whether we have healthcare and what our health looks like ultimately. And I think that's a good segue into a question for you, Lady. We're joined by Lady Garcia, who is the manager for health navigation and social services at CASA. And what makes your work special is that you oversee the teams of people that are answering the phones. If a CASA member, a member of the immigrant community calls the health hotline, someone on your team would answer the phone and they would hear the story of whatever the situation might be, right? Whatever social service or health service they're looking for, whatever problem they're facing, that's who is overseeing that outreach. It's your team. Can you talk to us a little bit about one aspect of that? Like if someone were to call the line and ask questions on the health or the housing situations, can you talk to us a bit about what that looks like, a story that's really spoken to you, so we can get a better understanding of how the pandemic has changed the work that you lead?
Yeah, so as we mentioned before, the struggles that our community are facing right now were not new to CASA. And part of what my department does is trying to be the bridge for the community members to access services that even if they are out there already, just by not knowing how to navigate the system makes it hard for someone, especially when they are immigrants. They don't know the language, they don't know the system that they're getting themselves into. So that's pretty much what my department does. Not only connecting families and individuals to services, but also making sure that we educate them on what the system is, what are the requirements for specific services, and making sure that we connect them to those services. One of the struggles that we saw at the beginning, and this is part of what CASA did, and I just feel so proud of what the organization did, and it was the food distribution, because we saw the need in the community for a simple, basic need as food, something that they weren't having access to. So CASA ramp up this distribution donations for families and make sure that everyone had food on their tables. So that was part of the amazing job that we did through the pandemic, at the beginning of the pandemic and the middle of the pandemic, where everyone didn't just know how far this was gonna take us. Mm-hmm.
There was a moment, I remember, where we were commenting to each other that this would be just a blip in time, right? We might be shut down for the next month, for the next 2 months, through the summer, and we're here 2 years later, right? And I think what makes CASA special, what I know makes CASA special, is that we are a power building organization. So food distribution, right? This savior type model is not something that CASA subscribes to. And so the fact that we had to pivot and offer the food distribution is something new that came out of the pandemic, because we saw that it wasn't being done in a way that served immigrant communities, Spanish-dominant communities, communities that spoke other languages. And so as we look at the other elements of the pandemic, like housing, right? What we saw is folks were told to stay home, not go to work. But if you're in the hospitality industry, if you're in the restaurant industry, if you're in the services industry, you found yourself without a job. How are you going to pay your rent and your other bills? And so I'm sure you saw that uptake of my landlord is trying to kick me out of my home because I'm unable to pay my rent. Or now someone is faced with paying months of back rent with no idea how they're going to come up with thousands and thousands of dollars. Can you talk a bit about what that was like and maybe, someone's story? I can think of a couple stories myself. What that was like answering the line and trying to navigate the different housing justice opportunities that came up during the pandemic.
Yeah, and that's a big part of what we try to do in our department. Like I mentioned before, is educating the community about their rights. So that was pretty much what the information line focused during that, and we're still seeing issues from people getting notices about being evicted. If you don't pay in 30 days, you're gonna be evicted by the 1st of July. So just educating the community, even if it's through a phone call, just someone calling our hotline and asking, how can I pay my rent? We have resources available, but also just know that you have rights as a tenant. That's so vital and that's the way that we empower our community. We don't only provide services and we connect them to whatever the resources are available out there, but also we empower them to really know that they have rights, even if they are undocumented or documented. So that's pretty much what we do at the information line also, and that's something that I always feel proud about. And just to give you some background about what the issue the community is facing right now. So we have resources, right? We have funds that are put aside to help the community to pay for rent in different counties. But just the access is difficult for our community in specific because of the language barrier. They don't know how to use a computer sometimes. They don't even have access to the internet. So even if those services and funds are available for our community, just having the access to them, it's difficult for them. So that's where our department, that's where CASA comes in and tries to break that barrier and make sure that these families that qualify for these funds, they have access to those. And we created the system, internal system about assistant community members apply for the assistant, upload every document that they needed because that's part of what's difficult for a community. They don't really know how to process these applications that even for someone with some kind of experience and computer skills is difficult. So just imagine someone that they don't really know the language, they don't know how to navigate the system. So that's what we do.
And I feel like navigating this complicated system was worsened during the pandemic when information was not flowing in the languages that people need. To the point where I remember, Dr. LaRue, you and I would get on Facebook Lives on the CASA Facebook almost every week just to give an update on where we are, what we can expect. All people knew was that if you went outside, the police could stop you and fine you, right? And do I remember correctly? It might have even been like a night in jail or something to try and dissuade people to stay home, which was the safe point, right? But the reality is that in the middle of this moment, there were thousands and thousands and millions of people that were facing this without health care. Can you talk to us a bit about health care and the Affordable Care Act and what that looks like if you have access to the Affordable Care Act, Dr. LaRue?
Sure. Like we were saying, access to the healthcare system in the United States is a key factor in building our health. But it's an expensive system. And so making sure that our families have access to care, and most of the programs that are set up in the United States are not ones that our community has access to because of eligibility concerns. And so we really have to rely then on community clinics or home remedies to get over any kind of illness or ailment that we may be facing.
Tea.
Yes.
We heard so many times que tomaban aguas, which is teas,
Yes.
for COVID. That's what it was like.
Yes, and then you have to also take in the larger context. Many of our community members, even when they felt sick enough to go to the hospital to seek care, wouldn't do so because of immigration concerns. Like they were afraid that ICE might be in the hospitals trying to round people up. And so this deters us from even seeking care. And so this greatly disproportionately affected our communities, not only in infection rates, like you were saying, so many of our community members worked in essential jobs that they didn't have the option to telework from home and be safe in their bubbles, had to go out and confront this virus, like you said, before the vaccines were even available. But then also just having that fear of, well, what if I do get sick? What if I then don't have access to the healthcare needs that I may need to be able to get over this? And also bringing it home to the family, because a big part of the pandemic is not only my own personal fears of getting sick and my health ramifications, but also how I may then influence the health of my family. If there's one thing that really hones in how interconnected we are as a society, is infectious diseases. But financial healthcare finance is also how we're also so interconnected, looking at all the uncompensated care that now hospitals bear that burden, is going to then turn into higher costs of then seeking care in the hospital, which turns into higher premiums for insurance. We all feel it, and we just don't see it on a day-to-day basis outside of the pandemic, which just altogether more disproportionately always affects our communities than the community at large.
Do you remember we were on one of those Facebook Lives and a mom out of Virginia kept messaging on the Facebook Live asking for help because her husband had COVID and they lived in one room.
Yes.
2 rooms. It was 2 rooms. And she had just had her baby, and it was the beginning of the pandemic when we didn't know a lot. And so trying to explain to her how it is, making it up, how you can separate yourself, put your husband in the corner, put your husband in the room, close the door, you slide the food in. Do you remember that? We had to tell her to like slide the food in and then just like disinfect it with this and that.
No, very clearly I remember that there was 2 key cases that came in from Virginia, but that goes back to like the different factors that influence our health, like going back to housing stability. Families don't have the economic fortitude to be able to have their own apartment, or the quality of the housing. When you live 3 to 4 families in one housing unit, you inevitably are bringing this back to the home, but to everyone. She was not only fighting, how do I breastfeed my child while I think I have COVID, the rest of my family has COVID, but then also she was thinking, well, what about the rest of the people who live here? She wanted to disclose to them that they had gotten COVID, but was also fearful that they would kick her out. Her and her family would then be instantaneously homeless, dealing with COVID and dealing with all the other factors.
Because she wasn't on the lease.
No.
So she had no right or claim or whatever written down on paper that it was good for her to stay there.
Right. And so educating them not only on the health side, like how to protect, like you said, disinfecting, washing hands, all of the strategies we have to prevent mitigating the vaccine, the virus, but then also, as Lady was mentioning, like educating people around their tenant rights, around what are the responsibilities of landlords and other renters is critical for the overall health of the community.
We can't ignore that in this country, a lot of times healthcare is linked to having a certain type of job.
Yes.
And in other countries, like me, I'm from Chile. And in Chile, you have socialized care, where the state provides some level of coverage, and there is an institutionalized process for vaccinating people, for taking care of folks. It's all public run, right? Which in this country never happened, because healthcare is linked to having a certain type of job. And so as we talk about the Affordable Care Act as like a way to, quote, make up for that, as a way to offer some type of coverage that the state, that the country, that the federal government can oversee and help facilitate, we have to focus on the types of legislation that will make up for the people who don't even have access to the Affordable Care Act. So not only are they not insured through their employer, but they are excluded from what is supposed to be the solution for getting care. And that's where I want to talk to you, Connie. Connie Serrano is the research and policy analyst at CASA. And the work that you do is so important because it's the opposite almost of ladies, right? Where lady is like person to person. You help thousands through the advocacy work of CASA members. And what's wonderful to see is that CASA and other partners have launched this multi-year campaign to challenge the state of Maryland to think bigger, to challenge the state of Maryland to offer health care to people regardless of immigration status. Can you talk to me a bit about the Access to Care Act bill and what that looked like in the first year of advocating for this? Because it is a stretch, right? And we know that we have to focus on this intentionally so that we can offer, so that the state of Maryland can offer this opportunity to people regardless of their immigration status.
Yes, definitely. So, we have to start looking at the fact that there's over 11 million people in the United States who do not have access to health care simply because of their immigration status. That means they don't have access to the Affordable Care Act, they don't have access to CHIP, they don't have access to Medicaid. And so in the state of Maryland, that's over 300,000 people who don't have access to these programs because of their immigration status. And so what the Affordable Care Act is supposed to do is fill in those gaps, but the one barrier is the immigration status for over 300,000 people. So what, CASA introduced a bill this last session that would break that barrier for the Affordable Care Act. And we knew it would be a huge undertaking and that this could turn into a multi-year campaign because it's not a cheap thing to do, but it's a necessary thing to do. Maryland is currently the #1 state that has the most wealth in the entire country. What's next to us is Massachusetts, and Massachusetts actually gives coverage to a lot of immigrants. And we're very similar to Massachusetts in a lot of ways. We have the exact same population, which is somewhere between 6 and 7 million people. We have the same, rural to urban areas. And the people are in the same kind of industries. So we have the capacity to build something very similar to Massachusetts, starting with removing those barriers. So it's something that, we as a state have to really take into consideration that, like my colleagues were just saying, these are essential workers. These people pay taxes. These people give back to their communities. Lady was talking about food banks. There, a lot of the folks who are working these food banks are, immigrants themselves, who themselves need the food, who themselves need money for rent, who themselves need support, and they're doing it for their neighbors. And so, we have to take all of that into consideration and really think that this is not something that we're giving people. This is something that people deserve. And when we look at other programs like Medicaid, we have room for expansion. States have been doing it themselves for a very long time. There are currently 17 states, and Maryland just became the 18th state to give Medicaid access to pregnant people regardless of immigration status. CASA was involved in a huge campaign last year to do the exact same thing in Virginia. So in Virginia in 2021, Medicaid became available for pregnant people and up to 60 days after pregnancy for postpartum care. In Maryland, we just passed legislation that gives pregnant people Medicaid as well as for 12 months postpartum care for both mom and child. So there is room for growth, obviously, in Maryland. Medicaid can continue to build on that and provide more and more care for other groups of immigrants. And we know that there are groups within groups that are even less served, right? We have a giant population of immigrants, but within that, we also know that Afro-Latinas are also extremely underserved, even within the underserved population. We know that the LGBTQ community is also extremely underserved within that population, right? And there's other layers of that as well. So this is not just an issue about health. This is an issue about systemic racism in the country, and the states that continue to just let it be what it is without actively trying to change the system.
That's exactly right. And the reality is, when we let a health problem fester, we all know that it only gets worse. And so something that could be prevented ultimately becomes a major problem where you have to seek higher care for. And I'll give you an example of Rafael. Rafael is a CASA member who was advocating for the Access to Care Act. And if you remember his story, when he testified in front of the General Assembly, he shared that the doctors basically fumbled his diagnosis, right? And so he didn't have health insurance, and he was having all kinds of major pains and problems, to what turned out to be a very simple solution. They ran all these tests because they couldn't find out what it was, because it was such a bad problem by the time he went to the doctor, right? And so as we think about what Maryland looks like with healthcare coverage, we can't forget that there's other aspects, like you were saying, Dr. LaRue, that play into the health and well-being of a community. And if we can go back into housing, we remember that the work that CASA did to help organize the members. If you remember, there still is this major rent strike that's been going on for more than a year, right? Because one of the landlords, a couple of the landlords out of PG County, Prince George's County in Maryland, would not work with the tenants to help with the payment plans that they would need in order to pay their rent, right? Ultimately, the best thing would be to just cancel the rent and to ignore those months of rent that they owe and forgive those opportunities. Lady, can you talk a little bit about how the role of government, local government, state government, is, and what opportunities they created to help with housing justice? Right? Because if you don't have a home, you can't stay home. If you don't have a home, you might be living on the streets. And if you're living on the streets, or if you don't have a home, you can't stay home, then ultimately that affects your health.
Yeah, so through the pandemic, from what we have seen, the courts stopped the processing for evictions. So that was part of what the government was trying to do to support the families at the moment that were facing being evicted. While they were still working in a lot of details, because I know by September they are allowed, the landlords are allowed at the beginning of September to increase the rent. And from what we have heard is that they're not even taking in considerations the recommendations that the government has put in paper. So they're going beyond the limitations. So that has been creating a lot of issues and awareness also on what we need to get done, especially organizing the community, especially working with the tenants, so they can speak up about what we don't get to know that happens internally with the landlords and the leasing offices. Because that's the issue. Someone that is being evicted just because they get scared, because what we have even heard from the community is that they get treated about immigration being involved. So they don't have documents, so they feel scared, and they just get an illegal 10 notice about being evicted. They just leave the apartments. And now they're facing homelessness. Now they don't know where to go. So those are the issues that we have seen in the community, and trying to create awareness, because they don't know, the government do not know if they don't work as a frontline for these issues. So we're talking about the issue. So hopefully someone with the power can really make the change for this, that is becoming a rent pandemic, or I don't know.
Yeah, no, I think we're going to see a lot of long-term consequences
Yeah.
of the pandemic, and the recovery is going to be long and drawn out, and it's going to be more so for our community because they've been the hardest hit, not just in their health, but socially with all of the other factors. But I do want to highlight one piece I think this housing really highlights is the amazing work that an organization like CASA does, looking at working on the policy side, working with local, state governments to put in certain protocols and protections for families, looking at like the frontline, supporting of individuals, like the work that Lady and our team does in Health and Human Services, of helping people enroll in rental assistance programs or other programs to support their family. So looking at systems change, but supporting the crises that they're living in at the same time right now, I think that's something that's very unique and powerful of what we do here at CASA.
And I quickly wanted to add that going beyond just having access to housing is having access to habitable housing. One of the things that we saw during the pandemic was even with students who didn't want to turn on their sound, who didn't want to turn on their cameras in their classes because their alarms didn't have batteries and they were making that beeping sound. And, we also saw people most of the folks who are being evicted from homes where the refrigerators don't work, where there's mold, where the bathrooms have pipes running water all the time. These are things that affect people's healths daily. And when you're home 24 hours of the day and you're being exposed to that, it's just going to create even more, it's going to create more health problems for you and your children, especially children who, want to get their hands on everything, and you don't have access to just being able to call your landlord and say, hey, this isn't working, because half the time they don't take you seriously, and they know the tenants they're not going to do anything about it.
So that's one half of the time. The other half of the time, the landlord is ignoring you because you weren't able to pay your rent, or you didn't pay your rent on time, or you had back rent that you were supposed to pay that you just couldn't pay this month. I remember walking into one of those apartment complexes that was part of the rent strike, and walking in and seeing on the wall in the kid's bedroom, there were these smudges of blood along the bed and along both walls. And it was a little smudge of blood, and you could tell that it was actually every smudge on this wall from here up several feet. I didn't know what it was, so I asked the mom. I was curious. We were there with the TV crew, and it turns out that every smudge of blood, every smear, was a bed bug. That as the kid is sleeping, he sees the bed bug crawling on the wall, and he kills it. That's what we're talking about. The landlord is ignoring that request because they weren't able to pay their rent this month. And so that makes the landlord think they're entitled to not taking care of the home and creating uninhabitable conditions.
You bring up a really great point, Josie. Looking at those bed bugs, obviously this is a huge health concern, but then also, how do you thrive as a family? How do you thrive as an individual when you're living in this environment? What's the quality of sleep that you're getting? What is your just normal state of calmness? It's gonna cause anxiety. I mean, it's linked to so many other issues, but really looking at how does this affect our health, quality of our housing, Connie was saying, is such a critical aspect, and it just goes back to why we've come up with all of these different categories that affect our health, and is not always directly related to healthcare. But here's this obvious bridge between the quality of our housing and our health. And I know you see this every day in the community members that we serve, right, Lady?
Yes, and even the basic preventive care, just the access to that. It's been an issue because we had the community clinics, and that's part of what the information line does. Provide and connect to the community clinics within the counties where the resident resides in. But from there, when they get diagnosed with a chronic disease, that's where the community clinic cannot provide follow-ups and chronic diseases treatment. So that service right there is cut off. So now we let out this member, this community member, with a diagnosis for a chronic disease without treatment. And now it arises more when pretty much just by being undocumented, and we try, because this is what we do in our department, we try to see what other resources are available for that specific diagnosis, but sometimes we find nothing. So now we are facing one of the examples that are always staying with me. A couple of years ago, before the pandemic, I worked with a single mother of two. She was diagnosed with cancer, with breast cancer, and unfortunately, by the time that we received the case, it was on a 4th-stage cancer. So pretty much, we couldn't really done anything for her. And our job was just making comfortable and trying to make a plan on what was going to happen for the kids. And it's not only her case, but millions of cases of fathers, mothers, just facing not having health access so basic as preventive, because I'm pretty sure that if this mother, she was only 33 years old. So I'm pretty sure that if this mother had access to preventive care whenever she started feeling certain things that are not okay in her body, it would be prevented and she will be here with her kids. So just that, it's a big impact on not only having access to healthcare, but even so basic as preventive and education. This is what one of the programs we do in CASA, the health promoters. So we have health promoters engaging the community and educating them on how to access these basic services, but also how to test themselves, especially as a woman, how you test yourself to make sure that you can get aware of maybe something going on in your body. And then you try to look for services after that. So just that piece right there of engaging the community with the health promotion, with the health promoters, is big. It's a big factor on saving lives, pretty much.
You're talking about health promoters, and that makes me think of how their work has changed, right? And the evolution of, yes, finding health insurance, yes, I mean, I can't imagine. I'm 32. That's, and I'm a single mom. That hits me to know that it could have been prevented, right? And so CASA's not a clinic, right? But the reality is, as we were confronted with the pandemic, we kind of had to be. Right. And I was talking earlier about how I was part of the medical trial to test the Moderna vaccine. And that was actually part of a program that CASA offered, where all in all, I mean, how many thousands of vaccines have we offered at our offices? And I wonder, Dr. LaRue, if you can talk a bit about how the CASA offices were transformed into a clinic in these communities that are very dense with the immigrant community members, purposefully, so that we could better vaccinate Spanish dominant, French dominant, and other immigrant populations.
Yeah, no, this, we could talk just solely on this for quite some time. I mean, we really had to respond to the community because the same programs, to be able to do these programs at large scale, things that the state and even counties were trying to implement, they were doing it out of more of a lens of what made sense. What can I implement quickly? You know, just the logistical undertaking that it was. But it was inevitably putting up the barriers that we have been trying to systemically put down all the time. Like, they were standing up mass vaccination sites, but mass vaccination sites are not in those pockets where our community was. Like, there was one at FedEx Field, but it takes 4 buses and 3 hours to get to FedEx Field. I have to take an entire day off of work, and our community works in jobs that don't have paid sick leave. And so looking at, again, the intersectionality of like the political work and the policy work that we do, coming into how it affects the activities of daily living of our community. And so being able to bring vaccine clinics directly into our centers, because we are in the heart of the community that we serve. We do them in a linguistically and culturally appropriate manner. We do them with the trust that we've built over the decades with our community. We do it at a time that's convenient for our community. So many of the clinics are typical 9 to 5 weekday clinics, and our community doesn't have access to those. So being able to bring them tailored programs like these vaccine clinics directly into our community, but then tying it into like the Moderna clinical trials, such a big part of also the pandemic response that we have done, and linking it to like the outreach of the promotoras, is making sure that we have accurate but timely information. Like those Facebook Lives that you were talking about, we have had to step up and keep our families informed, because those daily press conferences that were happening at the beginning of the pandemic, they were done only in English. They were only broadcast by English channel medias. And so we stepped up and having to bring this information, dispelling the myths and misinformation that were in our communities, which may be different misinformation that's circulating in the community at large. And then also with the globalization, you know, with how easy it is to share information via WhatsApp or text messaging or social media, we're dispelling misinformation coming from all parts of the globe. And this really, I mean, it's that knowing the community and tailoring the programs to the community that really sets us up for success.
What really sets us up for success as an organization is the model that CASA has maintained throughout all of this, right? Yes, we offer services to the immigrant and to low income and to communities of color, but ultimately it's that power building model that has helped champion policy change in every single state that we work in. And what excites me the most is that at the core of this moment, CASA members stood up, right? And to be a CASA member, it's someone that is low income, immigrant, community of color. And as we were talking about these major policy changes that we were pushing for as an organization, it was CASA members that decided the policy priorities. It was CASA members who really led that policy work. Connie, I wonder if you can talk a bit about the work that CASA does to change these major pieces of legislation, to find solutions for what are marginalized communities, and how it is those members of those communities who lead that work themselves.
Definitely, and one of the things is that, you know, our members are extremely resilient, and while they have suffered a lot because of their conditions, we allow them to find power within their stories to be able to change the system and to be able to change their lives. During this last session, for example, CASA members came out every single day during session. That's 90 days of session. Every single day they came out and stood outside of the Maryland General Assembly to make sure that legislators were seeing them, that they were speaking to them, that they were looking at them, and making sure that they saw that they were there to advocate for these bills. You mentioned Rafael, right? And we were just talking about primary care. Rafael came here as a young man 20 years ago, over 20 years ago, and he never received primary care. And now he's dealing with all these health issues that could have been prevented 20 years ago. And he stood in front of legislators, in front of press, in front of other members, in front of other partners, nonprofits, telling his story and sharing why healthcare was so incredibly important for his community. We had Maria, who came out and spoke for Healthy Babies, who shared her story about how she lost 2 babies because she did not have access to prenatal care during her pregnancies. And both have, left her with a lot of health complications. Again, because she didn't see a doctor until she was miscarrying. And so CASA is really proud to be that link between community and that power for them to change their lives for the better. And I'll just finish off by saying that, yes, our community is extremely resilient, but they shouldn't have to be, because healthcare is a human right and it's something that everyone should have access to.
I think the final question for each of you panelists is going to be about yourselves, about how you deal with such heavy loads as part of your professional life and still maintain the integrity of your mental health, how you keep yourselves whole as people. And I'll ask each of you in a couple words, a couple sentences, to talk about what you do to center yourself. I'll start. Because I know that during the pandemic, it really hit me hard that the uncertainty of the future, right? And I was someone who would challenge myself I had just finished a triathlon, actually, that fall, when in the winter, everything shut down. And for the longest time, I didn't work out. I didn't take care of myself. It was me and my couch and my dog. Not even my son. I closed myself off. And so it took me really talking to myself to find a way to hit the streets again and go running, right? I remember even leaving the house for one of our protests, our car caravan protests, for the ICE campaign that we had out of Howard County. That was hard for me to leave the house. But I remember challenging myself to keep working out, right? To clear my mind so that I wouldn't focus on whatever was going on in the moment. And I'd love to hear from each of you so that these words can inspire the people that are listening today. Because people that are watching are also interested in the health industry, and they will have seen something very similar. And so I wonder if each of you can take a moment to share what it is you do for yourself to keep yourself straight.
I think one of the key aspects that keeps me going is that resiliency that Connie was speaking to. Like, working with our community, directly with community members, seeing how, like you were saying, how much they've suffered, how much they're going through, but then also how much they pitch in, like you were talking about, like the food banks and how they're serving the communities, knowing that they need that service themselves as well. Like, working with the community really recharges my battery.
Lady, I think we have just a few more moments left. So Lady and then Connie, and then we will wrap up.
Yeah, I think I share the same feeling as Michelle, just having the opportunity to work with the community and really hear and connect with them in a deep level on trust. And that motivates me every day, just to keep it going.
I think for me, it's, this kind of work can be extremely overwhelming, especially when you add politicians to it, which can sometimes be very discouraging. So just having a good village to talk about it, to let it out, and that includes, my family, my friends, my dogs, my colleagues. I remember I had a really rough day in Annapolis this year, and as we were walking to our cars, I just started letting it out on Michelle, and we stood outside the parking lot for 20, 30 minutes. And I remember going home and just feeling so much better after that. So just really finding your core to lean back on when you need it.
Thank you so much, Coney. Thank you, Lady. Thank you, Dr. LaRue. And thank you to our audience who is joining us for this very exciting panel. I love hearing what's at the forefront of health of the immigrant community, of communities of color. And let me tell you that if anything spoke to you today, if any part of what you heard, whether it's the health justice aspect, the housing justice, climate justice, any aspect that we talked about today, we welcome you to join us, because the reality is that we always need that support, right? We always look for advocates like you, for your time, for your energy, for your resources to help bolster the work that we're doing so that we can continue changing lives of the communities that need it the most. So I welcome you. Please go to wearecasa.org and support directly through a donation, because really that's what we need to keep this work going, right? We don't need the pat on the back. We don't need the thank you. We appreciate it. But what will continue fueling our work is you. Thank you for joining us, and we welcome the next chapter of the health for the immigrant community.